It's all right. Now, repeat the types of the last thing you read. Right? Alright. Now, that's now let's have a recap on our discussion on communication. So, what's communication? If you are listen, come in. If you are looking at your notes now, you are wrong. Like I always tell you all, you don't fail my exams. So if you're looking at your notes up to this point, you are what? You are wrong. Now, what is communication, everyone? According to Kosia and Ed, what is communication? All right. According to nursing, what's communication? I'm impressed with a lot of you. Those that are reading, like I always tell you, you have no reason to have rest. Are you hearing me? So please make sure you are reading. Now, after the definition, what else do we discuss on? Now, what are the types of communication? Now, please, no noise. What are the types of non-verbal communication? Now, listen. Is silence a verbal communication? Is it non-verbal? Is touch a verbal or non-verbal? Gestures, verbal or non-verbal? What are the types of communication according to direction? Now, now listen. Now listen. I want us to go in unity. What are the types of communication according to direction? Uh-huh. Now, the communication between two nurses is categorized as what? The communication between these are things you will see in your exam. Now, the places you now need to go and read, I will say, be careful. The places that you now need to go and read are the characteristics and the features. Don't neglect it. That's why I took my time and I gave it to you. Now, the communication that is between a doctor and a nurse is what? The communication between a year 3 student and a year 1 student is what? Or what? Upward. Now, when it is the year 3 discussing with, instructing the year 1, what communication? When it is the year 1 discussing, all right. Now, we now had an introductory class where we made an introduction on sepsis. I'm impressed that everyone is in the same pace for communication. I'm impressed about that. Now, that will branch us towards sepsis and aseptic techniques. Sepsis and what? Aseptic what? Techniques. Now, what is sepsis again, everyone? Sepsis is a life-threatening condition. So, what are the organisms that can cause this sepsis? All right, we have a lot of microorganisms that can cause this what? Sepsis. And we said that when this sepsis moves to the blood, it becomes what? And in the last class, I taught you that whenever you see the word anemia, we are talking about what? Blood. Now, remember we're discussing foundation of what? Nurture. Now, like I always say, this is what? Foundation. Are we together? This is what? Foundation. Before you, the second years now, they went for their psychiatric posting. Now, before you are being introduced, I don't know, you'll be talking with that girl. Before you go into what? The hospital setting, there are certain foundations you should have. Are we together? And number one of this is what? Aseptic technique. What did I say? Aseptic technique. So, and this aseptic technique is to prevent what? Sepsis. To prevent what? The what? The what? Anemia. Absence. Anemia. That is related to what? Blood. Avascular. Yes. Absence of what? Vascularity. That is loss of life. Asepsis. Absence of what? Sepsis. Are we together, everyone? People at the back. Are we together, everyone? Asepsis is what? Absence of what? Sepsis. So there are certain techniques that you, as a student nurse, must put into practice to prevent what? Sepsis. That is what will give us a better introduction to what we call aseptic technique. Are we together, everyone? I just simplified this so that you don't cram. You don't cram in my class. We already know what sepsis is, right? That is infection when in the blood, septicemia. Now, absence of sepsis is what? Asepsis, right? People at the back. Absence of sepsis is what? Asepsis. Now, there are techniques that you must, is a must, that you must put into practice to prevent sepsis. So what are we going to call that technique? Aseptic what? Is it clear now? I can't hear you. Is it clear? Is someone confused? All right. I said again that when someone is contaminated with nosocomial or whatever kind of infection, it is what? Sepsis. Can be caused by bacteria, can be caused by fungi, can be caused by virus. Now, the practice, what you are supposed to do to prevent sepsis, to prevent the bacteria from affecting you, what you are supposed to do to prevent virus from getting in contact with you, is what we call what? Aseptic technique. These are techniques used to prevent what? Sepsis. Is this clear now? I don't want to see anybody sitting. She's not feeling fine. Sit up. Are we together, everyone? Please, are we together, everyone? Are we writing today or? All right, but we are going to be very fast. Are we together? Aseptic technique is a set of practices. Mark that word, practices. Mirabel, you can go. Aseptic technique is a set of practices and procedures used to prevent the introduction and spread of microorganisms into wounds. You need to be very fast. Sterile tissues, wounds, sterile tissues, body cavities, equipment, body cavities, equipment, and other areas where infection could occur. The main aim of aseptic technique is to prevent contamination. The main aim of aseptic technique is to prevent contamination and reduce the risk of infection. The main aim of aseptic technique is to prevent contamination and reduce the risk of infection. This is a short question. Objectives of aseptic technique. Number one, to prevent contamination of sterile areas. To prevent contamination of sterile areas. Number two, to prevent healthcare associated infections. To prevent healthcare associated infections. Number three, to protect patients from harmful microorganisms. Number four, microorganisms. Number four, to protect health workers from infection. Number five, to prevent cross-infection between patients. Now, all eyes on me. Those that are bending their head, you are wrong. To prevent cross-infection between patients. Now, how many of you have heard of IELTS exam? If you know you've heard of it, raise your hand. Raise it very well. 3 people only. 4. IELTS exam. Okay, only approximately 10 students. Now, how many of you have heard of NCLEX? Okay, see you. Now, how many of you want to travel out? Now, listen. Everyone wants to travel out. Now, before you write that exam, let me just brief you a little. You need to be an active listener. I am taking, so many of you will hear it and you will still want to know what I say. Because the criteria for passing a part of that exam is your ability to listen actively, not passively. Some of you, your ears are open, but you need to what? Listen what? Listen what? Actively. Pick the words once. So why I'm telling you this is so that you can start now to train your listening skill. Correct. Are we together, everyone? Because it will help you. Before then, I might give you the way to follow. Now, types of aseptic techniques. Number one, we have the medical asepsis. We have the word medical asepsis. Now, this is also called a clean technique. It involves practices that reduce the number and spread of microorganisms. Examples include it involves practices that reduce the number and spread of microorganisms. Examples include hand hygiene. Number 2, wearing clean gloves. Number 3, cleaning the equipment. Number 4, proper disposal of waste. Number 5, proper handling of contaminated materials. Proper handling of contaminated materials. The second type is what? Surgical asepsis. Surgical asepsis. This is also called a what? I'm not hearing you. It's also called a what? Sterile technique. Correct. It involves practices designed It involves practices designed to prevent microorganisms from entering normal. Are we together, everyone? Surgical asepsis involves practices designed to prevent microorganisms from entering normally into sterile areas. From entering normally into the sterile areas of the body. It is used during, number one, surgical procedures. Number two, sterile wound dressing. Number three, urinary catheterization. Have you heard of catheter before? Urinary catheterization. Next is number what? Insertion of invasive devices. Insertion of what? Invasive devices. Inversion. What did I say? Insertion. Insert. Insertion of what? Invasive devices. Principles of aseptic technique. Those that you are very wrong. Go on, get it there. You are very wrong. Go on, get it there. Principles of aseptic technique. Number one, hand hygiene. Hands should be cleaned before and after patient contact. Hands should be cleaned before and after patient contact. Some people will leave the class very soon. Hands should be cleaned before and after patient contact and before performing an aseptic procedure. Number two, sterile items should not be touched unnecessarily. Next one, a sterile object should only come in contact with another sterile object. A sterile object should only come in contact with another sterile object. Now you see these principles, you need to know them. You must write, you need to know all of them. So listen carefully. A sterile object should only come in contact with another what? Sterile. A sterile field must be protected from contamination throughout the procedure. A sterile field must be protected from contamination throughout the procedure. Have you written that? Keep the sterile field dry. Keep the sterile field dry because, just put a column, moisture can allow microorganisms to pass through some materials and contaminate the sterile field. Moisture can allow microorganisms to pass through some materials and contaminate the sterile field. Stand up. Moisture can allow microorganisms to pass through some materials and contaminate the sterile field. When in doubt, next one. Yes, when in doubt, consider it contaminated. Yes, when in doubt, you are doubting, is this still sterile? Consider it what? Contaminated. An item is considered whose sterility, the same explanation of this. An item whose sterility is uncertain should not be used as a sterile item. An item whose sterility is uncertain should not be used as a sterile item. Now, that would be, I will send it across, to be in the notes. Hope all of you have seen the note I sent. Yes, communication, yes, only that, I've seen that. Examples of aseptic technique. Examples of aseptic technique. Number one, washing or sanitizing hands appropriately. Washing or sanitizing the hands appropriately. Number two, using sterile instruments. Using what? Sterile instruments. Three, proper disposal of contaminated materials. Proper disposal of contaminated materials. Next is what? Avoiding unnecessary contact with sterile equipment. Avoiding unnecessary contact with sterile equipment. Are we together, everyone? Yes. The rest will be sent across. Let's just give a quick recap so that we can dive into the next. Now, what is sepsis? Now, as we are starting now, everybody, you stand up. Now, everybody, I want an audible class. Are we together, everyone? Yes. Now, what is sepsis, everyone? Sepsis is a life-threatening condition that occurs when the body's immune system responds abnormally leading to widespread hospitalization, tissue damage, organ dysfunction, and if untreated, can death. Alright, and we explained that when an infection colonizes, enters into the body, colonize, it leads to what? Sepsis. And we are not saying that, don't talk again, see that. We are not saying that the absence of sepsis is what? Everybody, I want us to. So, Sepsis, presence of what? Infection, right? Absence of infection and sepsis is what? Now, the practices that is being done, because there must be what? A practice. The practices that is being done, the techniques that is being done to prevent sepsis, that is to prevent bacteria caused infections, virus caused infections, the practices that you very soon that will be going to the hospital for your experience must keep is called what? Is this simplified? So there must, if not there will be, for you to be safe in the hospital, there must be certain practices that you must keep. I didn't say you will. You must what? Keep them to prevent what? Sepsis. I'm coming. Question. And we now have two types of these practices. What and what are the types? Medical asepsis and surgical asepsis. Are we together? Medical what? And what? Surgical asepsis. Now, that brings you to the exam you're about to write now. All eyes on me. That brings you to the exam you'll be writing very soon, which is what? Osce. You are MD1, are people reading it? Now, in that exam, you are going to specify if you are handling a clean procedure or what? A what? Sterile procedure. Are we together, everyone? Now, another name for clean procedure is what? Medical procedure, medical what? Asepsis. Are we together? Then, another name for sterile is what? Or what? Asepsis. Or what? Sterile asepsis. Now, what is the difference? Please, everyone, are we together? Yes. I'm not hearing us. Yes. Are we together? Yes. Now, what is the difference? There are people that is bending their eye, their sclera. I want to see your scleras. Are we together, everyone? Yes. Now, there is a core difference between clean procedure and what? Sterile procedure. Now, there's something they call catheter. How many of you have put catheter for someone before? You've put catheter, male or female? Okay, you put for both men. Who sent you to put it? Huh? Where? I can't hear you. In the hospital. Have you worked in the hospital before? Okay, you've worked in the hospital. Okay. Are we together, everyone? I can't hear you. Are we together? Now, listen. As a nursing student that you are, that procedure, what's her name? Okay, stand up. Stand up. Now, that procedure, where can we classify it? Is it a medical procedure or a sterile? Is it a clean procedure or a sterile procedure? Why? Because we are going into the body. Are we together? We are trying to do what? Go into the body. And if it is not sterile, it can lead to introduction of what? Microorganisms, which is the what? Sepsis. That is what brings us to them. Thank you. That is what brings us to hydrogenic infections and nosocomial infections. Someone went to the hospital and you went and introduced Microorganisms. You use your hand and open the catheter, and you inserted the catheter. Your hands are probably, you did not wash your hands. That's number one. You failed the clean procedure. And instead of maintaining a sterile procedure, you still did it wrong. So that will lead to introduction of microorganisms, which will now lead to what? Sepsis. I'm coming. Are we together, everyone? So examples of, I want you to know this, I don't want you to cram. Examples of medical asepsis. Whenever you hear this line, all this line, whenever you hear of the word medical asepsis, what comes to your mind? Stand up. All of you stand up. Stand up, everybody. Stand up. Go on, stand up. Now, this line, whenever you hear of medical asepsis, what comes to your mind? Huh? People at the back are not hearing you. A clean what? Procedure. Now, is a clean procedure sterile? This line, is a clean procedure sterile? Okay. Now, examples of clean procedures. Number one is what? Hand washing. That is why, listen, for your Osce exams that you are going to write, you must what? Wash your hands. Now, the process of you washing your hands is a what? You wash your hands. Are we together? You wear your gloves. All these things have man. You wash your hands. You do what? Wear your gloves. Now, I want you to think rationally. Taking a needle or a needle or a syringe with a needle and placing it properly, disposing it properly, is it a sterile procedure, a clean procedure? Huh? It was clean procedure. Proper disposal of what? Equipment is what? Clean procedure. Now, picking up, listen, picking up an instrument and cleaning it, is it a sterile procedure? Now, whenever you hear of the word sterile, how many of you have seen doctors carrying out surgical procedures? You will see them raising their hands up. Have you seen it, right? Even the person that will do the glove, the person that will wear the glove, will also be sterile. Anything coming into that lab or that room, operating room, must be what? Sterile. The instruments will not be placed anyhow. You don't touch it anyhow. Everything must be what? Sterile. Because you are invading the skin. So you washing your hands alone is not sterile because after washing your hands, there can be question. Please, are we together, everyone? Now, urinary catheterization, is it a clean procedure or a sterile procedure? Now, this line. Wound dressing, I don't want to hear it. Wound dressing, is it a sterile or a clean procedure? See that. Carrying out a CS on a woman, is it a sterile or a clean procedure? When you touch a patient and you wash your hands, is it a sterile? But both of them, when you are washing your hands, are you maintaining asepsis? Yes. But what type of asepsis? Medical aseptic technique. Are we together now? Yes. I believe everyone have a good foundation on this topic. Firstly is what? Sepsis. Secondly is what? What is asepsis? The third is what? Aseptic what? Technique. Next is what? The principles, right? And next is what? The types. What are the types? And what? Now, what are the examples of aseptic practices? Everyone, let's read. Now, that brings us to an important point called sterilization. Your question. That's microbiology, it's not part of what we do afterwards. Question? Question? Now, I'm coming. Sterilization, you can go. What's that your name again? Sterilization is a validated process that destroys or removes all forms of viable microorganisms. Sterilization is a validated process that removes or destroys all forms of viable microorganisms. I should repeat. Sterilization is a validated process that destroys or removes all forms of viable microorganisms, including bacteria, viruses, fungi, etc. Sterilization is especially important. Active listening. Sterilization is especially what? Important for instruments that enter normally into the what? Sterile tissues or the vascular system. Sterilization is especially important for instruments that enter normally into what? Sterile tissues or vascular system. Objectives of sterilization. Number one, to destroy microorganisms. Number one is what? Number two, I love that. Number two, to destroy, to prevent infection. Number three, to make reusable instruments safe for patient care. Next, to protect patients undergoing invasive procedures. To protect patients undergoing invasive procedures. Classification of sterilization methods. Classification of sterilization methods. It can be classified into two, the physical method and the chemical method. Now, every student, what are the classification of sterilization? Now, I'm going to send the note across, which will be detailed because of time. So the physical method includes use of radiation, right? Radiation, dry heat, moist heat, chemical method, use of hydrogen peroxide, let me know those that did art and came into what? Nesting. Hydrogen is at what element? What is the atomic number of hydrogen? What is the symbol? What about oxide? Now, what is moist heat sterilization? Moist heat sterilization, I'm reading, right. Moist heat uses steam or hot water. Moist heat. Based on the physical, we have moist heat, we have dry heat. So moist heat uses steam or hot water to destroy microorganisms. Steam. The most important method used in healthcare is what? Autoclaving. Correct. An autoclave is a sterilizing device that uses steam. Right. Yes. Just right. An autoclave is a sterilizing device that uses saturated steam under pressure. So autoclave is under moist heat sterilization. It uses what? Saturated steam. Hope we know the one that is in, right? And I will tell everyone. An autoclave, right. I will explain later. Right. An autoclave is a sterilizing device that uses saturated steam under pressure to destroy microorganisms. It is done using 121 degrees centigrade for 15 to 30 minutes. 121 degrees centigrade for 15 to 30 minutes. Materials that may be sterilized by autoclaving. Number one, surgical instruments. Materials that may be sterilized by autoclaving. Number one, surgical instruments. Number two, metal instruments. Yes. Advantages of autoclaving. I will send it so you see the rest. Advantages of autoclaving. Number one, it is highly effective. Let's pay rapt attention. Don't repeat again. Number one, it is what? Now, there are some wonderful students that is not copying. And I'm impressed with you. Because during exam or quiz, you must show me an evidence of being in my class. To all of you that is looking at me and just soliloquizing, and all those that are undergoing a transhuman movement during quiz or exam, number one is the 75% attendance and your note. So I told you the best thing to do for yourself is to copy so that you don't stress again. Now, advantages of autoclaving. Number one, it is highly effective. It is effective against bacteria. It is effective against bacteria or microorganisms. Advantages of autoclaving. Next is what? Dry heat sterilization. Dry heat, are we together, everyone? Please, if you miss, I'm trying to be fast. If you miss any, ask your neighbor. Dry heat sterilization, it uses hot air to what? Destroy microorganisms, mainly through oxidation and protein denaturation. Denaturation. Yes. Dry heat sterilization uses hot air to destroy microorganisms, mainly through oxidation and protein what? Denaturation. The most commonly performed equipment for this is what? Hot air oven. I told you, I was thinking. Yes. The most commonly used equipment for this is what? Hot air oven. Go outside. It can be done 160 degrees centigrade for 120 minutes. 160 degrees centigrade for 120 minutes. Or it can be done 170 degrees for 60 minutes. It can also be done 180 degrees centigrade for 30 minutes. And this depends on the equipment and the manufacturer's instruction. So the time frame depends on the equipment and the manufacturer's instruction. Radiation sterilization. This is the use of ionizing radiation to sterilize certain medical products. This is the use of ionizing radiation to sterilize certain medical products. Examples include gamma radiation. This is the use of what? Ionizing radiation to sterilize certain medical products. Examples of equipment that can undergo this radiation is syringes, catheters, Now, that brings us to a point, disinfection. We first describe aseptic technique, right? After that, what next do we describe? Sterilization. Now, the next is what? Disinfection. Now, if you listen carefully in your microbiology, this would be simple for you. Now, disinfection is the process Disinfection is the process of eliminating many or most Disinfection is the process of eliminating many or most pathogenic microorganisms from inanimate objects and surfaces. Method of disinfection. We have the physical method and the what? Chemical method. Now, there's what we call the concurrent and terminal disinfection. Right subheading concurrent and terminal disinfection. This is where we're stopping. We're going to, I will explain. This is where we're stopping in the right. Concurrent disinfection and terminal disinfection. So concurrent disinfection is under disinfection, but it's subheading. Concurrent disinfection refers to disinfection Concurrent disinfection refers to disinfective measures carried out while an infectious patient is present. Concurrent disinfection refers to disinfective measures carried out while an infectious patient is present. And the purpose is to prevent microorganisms from spreading to other patients. Healthcare workers. Am I fast? All right. And the purpose is to prevent microorganisms from spreading to other patients. Healthcare workers, visitors, equipment, or the surrounding environment. Examples: performing hand hygiene, cleaning frequently touched surfaces, Number 3, cleaning blood and body fluid spills appropriately. Cleaning blood and body fluid spills appropriately. That's why I said I was saying the notes. I won't read everything. Next is termination disinfection. My wonderful students, are we together, everyone? Am I fast? Okay, let me repeat. Now, where did you stop? Huh? The people that shouted no. Hey, no, what? Stand up. Where are you? Come with your note. Let me see. Okay. Go down. You're in. Okay, number one. Number one is what? Huh? Okay, examples. Performing hand hygiene. Number 2, what did I say number 2 is? Number 3. Okay, number 1, performing hand hygiene. Number 2, cleaning frequently touched surfaces. Are we not together, everyone? Number 3 is what? Cleaning blood and body fluid spills appropriately. Spills, you can't say spills. SPILL. Now, this brings us to what? Terminal what? Disinfection. Terminal. Terminal disinfection refers to cleaning and disinfection terminal disinfection refers to cleaning and disinfection of the patient's environment and the equipment of the patient's environment and the equipment. After the patient has been discharged, transferred, or is no longer occupying the room, discharged, transferred, or is no longer occupying the room. And the purpose is to make the environment safe. The purpose is to make the environment safe for the next patient. After disinfection, we discuss on concurrent and what? Terminal. Now, the next is what? Isolation. Isolation. This is the separation of a person. This is the separation of a person who said that. Let's. This is the separation of a person with a known or suspected communicable infection. Now listen, everyone. Stop writing. Stop writing. Listen. Most of the noise is coming from here, and I don't know. Please, let's be careful. If you miss any point, kindly raise your hand up. I will not translate those repeated words again. Are we together, everyone? Yes, sir. Are we together? Yes, sir. Now, isolation is the separation of a person with a known or suspected communicable infection from people who may be Are we together? Yes. Let me repeat for those that are right. Isolation is the separation of a person with a known or suspected communicable infection from people who may be susceptible to the infection in order to prevent transmission. Write it if you know what it is. Right? Objectives of isolation. Isolation is the separation of a person with a known or susceptible. People are making me make mistakes. Now, let me repeat. Isolation is the separation of a person with a known or suspected communicable infection from people who are likely to get that infection in order to prevent transmission. From people who are, many of you can spell it now, right? You can spell it, so that's why I changed the word. I paraphrased it. Huh? who are likely to get that infection in order to prevent transmission. Now, objective of isolation: to prevent transmission. Number one is to prevent transmission of infection. Now, because of time, because I said that I'm going to round up everything in this assets today. Now, let's explain. Where do we stop at the initial explanation? Okay. So what is sterilization, everyone? I'm not hearing some people. What is sterilization? Sterilization is a validated process that destroys the including bacteria, viruses, fungi, etc. Sterilization is no. Very well. Again, everyone, let's repeat. Sterilization is a validated process that destroys all forms of microorganisms, including bacteria, viruses, fungi. If you are not reading, you are wrong. Again, a recap, everyone. Sterilization is a validated process that destroys all forms of microorganisms, including bacteria, viruses. Now, what is the key thing that we are seeing in that sterilization? Destruction of what? All forms of what? Viable microorganisms. So that is why it is termed what? Sterilization. And from sterilization, we coin out what? Sterile. Are we together, everyone? And we said that another name for sterile procedure is what? Which is the most efficient when you are going in an invasive procedure. We use what? Sterile procedures. Now, to make something sterile, it must undergo what? Sterilization. Please, are we together, everyone? All right. So that is one key thing about sterilization. If you write it that way, you are correct. The process that destroys all forms, whether it is bacteria. Now, listen, everyone. Are we together, everyone? Yes, sir. I'm not hearing us. Are we together? Yes, sir. Now, there are patients that can come with a virus, for example, HIV. One of the procedure or one of the process that have the ability to prevent contamination is what? Sterilization. Please, are you people listening to me at all? John, are you hearing me? Are you hearing me? Sterilization. Now, when you are working in the hospital and like I keep telling every student, all eyes on me, everyone. Now, I keep telling my wonderful students, when you go for your hospital experience, there are people that have gone for that experience and they had little prick and they had punctures. And that is one scary part about hospitals. Nosocomial infections. Are we together? Now, if you're working in the hospital and you use probably a scissors and you are trying to do wound dressing for a patient and the blood spilled on that scissors, surgical scissors. Now, will you throw that scissors away? No. Just because the person is having HIV? Now, will you go and wash that scissors? Yes, you will wash it. Now, washing it, is it a form of asepsis? Yes. Which is what? Now, does that medical aseptic technique have the ability to destroy the microorganisms completely? Now, but can we agree that though you wash it, there is a form of microorganism that was destroyed? Now, but did it destroy 100%? Now, for hospitals to reuse equipment, they must undergo what? Sterilization. Because sterilization has the ability to do what? People at this back, all of you will stand up very soon. The sterilization has the ability to do what? Very correct. So that is one key characteristic that I want to see in your exam. And when you are going even to any hospital, you will ask professional, have you sterilized this? That statement is coming from an in-depth knowledge. Not when they say go and sterilize this, they're saying, how are they going to sterilize this? Many of you don't know what is sterilization up to today. True of us? True. Now, when you hear sterilization, is the ability to do what? Put subject and equipment in order to do what? Delete or destroy or eliminate all forms of what? Viable. What does viable mean? Living, ability to reproduce more. So sterilization has the ability to destroy all forms of what? Microorganisms, whether bacteria cause, whether virus or fungi. Sterilization has that ability. Now, every wonderful student, what is sterilization again? Sterilization is the regulated process that destroys or removes all forms of microorganisms. If you are not reading, you are wrong. Now, again, a recap, everyone. Sterilization is the regulated process that destroys or removes all microorganisms, including bacteria, viruses, fungi. And now, to sterilize anything, it must be subjected under two methods. So what are the methods? You are wrong in this class if you are crowning. What are the two methods? Again? Physical, what is funny? Assistant custodian. What is? Huh? I heard. Okay. So we have two methods. What are they? And the physical method is the one that uses what and what? Again? Now, a student is asking me, what is steam? Who was that person that asked me? You are a science student, right? You did chemistry, right? You know what steam is. So there are different in that physical method, there are different ways. One is using what? Moist heat. Whenever you hear the word moist, it has to do with what? Steam. Are we together?
Yes, sir.
So, using steam. So, an example of a device that uses moist steam is what?
Autoclave.
Now, every wonderful student in this class is going home with this. Sit up. What does autoclave use? Yes.
Under pressure.
What does autoclave use? Yes. Now, how many degrees? This is an exam question. Please know it. How many degrees? 121 degrees Celsius to what? For what? How many minutes? 15 to what? 30 minutes. Don't forget it. And we use autoclave for metal equipment. We use autoclave for what? Surgical. Now, you working in the hospital and you are going for your posting. No. And you are being given 121, not 120. You are being given, like I said, you are carrying out wound dressing on a patient, and the person, there is blood spills on that scissors. Will you quickly go and use it on another person?
No.
So, after washing, what device can you subject it into?
Autoclave.
For how many minutes? I can't hear this side again. 15 to what? 30. How many degrees? Did you learn something today? Yes. All right. Now, next is what? Drying heat. This is using of what? Hot air. Subjecting equipment to what? Oven. The hot air. Now, how many degrees can that be subjected? 160 to for 120 minutes, right? Next is what? This line. Next is what? Again? This middle line and this line, you are not talking. Again? 160 to 1 for 120 minutes. 170 for 60 minutes. 180 for 30 minutes. Exam question. How many minutes do we use respectively? 60. Let me know those that understand what I'm saying. Respectively, 60 minutes, 120 minutes, and 30 minutes. How many degrees? You are wrong. I said, listen to question. That is why many of you, she's correct. Some people are wrong here. I said, respectively, 60 minutes, 120 minutes, and 30 minutes. How many degrees, respectively? The first one is what? Second one? Third one? Correct. Now, again, how many minutes? 160 for? I'm not hearing some people. Uh-huh. Hope it has entered. Yes. And this can be based on the manufacturer's instruction. So now radiation is the use of what? Ionizing rays. Now, that brings us to what we call what? Concurrent and what? Again? Trauma again. Concurrent and what? Terminal. Now, what is concurrent, everyone? Now, listen. Be careful. Now, listen. You are in school to learn. Are you hearing me, everyone? While you are working in the hospital, there are some words I want it to be expelled from your mouth. Now, while working in the hospital and you see a patient that can transfer infection, they have probably communicable, undergoing treatment, and you are being told to go and disinfect that area. For you being in my class, what language suits this discussion and the instruction? Go and do what? Carry out a what? A what? Concurrent disinfection. Please, do we understand where we are going now? So wherever you are being told, go and carry out a concurrent disinfection. That means this person is still present in the hospital there. And you should what? Because you've noticed that the person has probably like tuberculosis, for example. Or let's put it, someone that is vomiting blood. All right? That's hemoptysis. That's coughing. Someone that is vomiting blood. Are we together? Yes, sir. For example, hemoptysis. Hope everyone in this class knows what hemoptysis is. Yes. Now, for example, hemoptysis. And you are being asked to, the person is still in the hospital, and you are being asked to go and, for example, you are being told, what is the best language to say? Can we say, go and carry out a concurrent disinfective measures there? Yes. I'm not hearing us. Yes. Because the person is still present in the hospital. And we are doing this because if not done, there can be what? Transmission. For example, there are conditions that have high transmission rates, like coronavirus, for example. You understand? So any disinfection that you do while a patient is still present in the hospital is called what? Those people lying down, wake them up. Tell them to sit up. It's called what? Very correct. And the purpose of this is to prevent the spread of microorganisms to other patients, even you as a health worker, visitors, equipment. Now, next is what? Those laughing without any reason. You are wrong. Now, next is what? Terminal. Are we together, everyone? Terminal disinfection. Everyone, let's read. Let's know what it is. Again, everyone. If you are not reading, you are wrong. Very correct. Now, the difference between concurrent and terminal is that Now, when a patient leaves probably someone that spilled blood but was transferred. Now, listen, question. A patient spilled blood on the bed, but due to some medical emergencies, he was transferred to another ward. Now, what kind of disinfection is done? Please, let's be correct. In the same hospital, what kind of disinfection is that? People that are not talking, you are wrong. Those are the back. I say, let me repeat again. Exam question. Listen, everyone. A patient, listen, a patient in the ward was transferred to another unit. And you, as a nurse, you are asked to disinfect the bed where they spilled blood. What, in the same hospital, but transferred to another unit in the same hospital? What type of disinfection? It's called what? Yes, you are correct. Now, next is what? Isolation. Right? Now, isolation is the separation of a person now, when the medical personnel suspects that this can lead to a transfer to another person, to someone that has a compromised immune system. No, there are people here that someone with TB can be coughing, they will not get anything. Why there are people that have compromised immune system? Anything can lead to what? To infection. So what they need to do is to what? Isolate, to bring out and go and separate. The word isolation means what? Separation. This is where we stop, right? All right, quickly, what are the objectives? Huh? Now, quickly, let's have a quick recap. Okay, before a quick recap, let's take attendance. Now, let's take attendance. Now, but notify me, every wonderful student. Hope you learned something from today's class. All right. God bless you. Give me attendance.